Hi, I'm Dr. Dan. I'm an infectious disease physician in Atlanta, Georgia. You're watching The Relaxing Sounds of Infection, and this is my hot take on the newly approved Johnson & Johnson slash Janssen single-dose coronavirus vaccination. Now, this vaccine is different than the two vaccines that we have available right now, the Pfizer and Moderna mRNA vaccines. The Johnson & Johnson vaccine is actually a DNA vaccine that's packaged inside of a type of cold virus called an adenovirus that's been specially modified to not be able to replicate within your cells. The vaccine can't cause you to get infection with the cold virus. The primary endpoint of all vaccines is to prevent death and hospitalization from COVID-19. And this vaccine, like the other two vaccines that we have, works very well in that regard. Their phase 3 trial has over 40,000 people in it, and they used a very broad geographic distribution, I believe 8 countries in which they did the phase 3 testing. The important thing is many of these countries included places that have the variants of interest, like the Brazilian variant and the South African variant. And they were finding that the participants in their vaccine trial were often infected with those variants. So looking at the phase 3 data is actually really important because this data shows how well the vaccine works against those variant strains that we're concerned about. And the efficacy tended to be around 60 to mid 80%. Now, many of you know that the mRNA vaccines that we have available here were about 95%. When you tease out the data and look at the Johnson & Johnson single-dose vaccine in the United States, it's about 85%. The answer of which vaccine should I get is the first one that's available to you is the correct answer. So if they have Moderna, Pfizer, or Johnson & Johnson, get whichever one is available to you. If you have a choice between all three, it gets a little bit more interesting. Now, data on the Johnson & Johnson vaccine is still early, but one thing that stood out to me was that the efficacy was lower in folks over the age of 60. So if you're over the age of 60, it may be worth it to get either the Pfizer or the Moderna vaccine. Alternatively, if you have no way to get back to get your second dose, it may be better for you to get the Johnson & Johnson single-dose vaccine. One other thing that's going to be coming soon is the efficacy of a 2-dose Johnson & Johnson vaccine. So it may be able to bridge some of that loss of efficacy by getting a single dose at a later time. So keep that in mind. When it's your turn, when your phase is called to get vaccinated, get whatever vaccine you can. That's the most important thing to take away from this. Hope you enjoyed the hot take. Have a good night.